Hey guys, look! I didn't get to use this that much on Cinco de Mayo, so I'm just going to be using this intermittently during our show tonight. Welcome, guys. It's Wednesday. It's May the 12th. But more importantly, you know what it is? It's Hump Day. That means it's happy hour for the dinks. So welcome to Dentists in the Know. This is your backstage look at current trends, politics, and education in the dental world. It is live, and it is over a cocktail with my besties. Right there is Dr. Jennifer Bell.
Hi.
Next to Jennifer is Dr. Chad Duplantis. And we are all practicing dentists. We're all catapult educators. And we are all business owners. Our job is to bring all of you, this is going to get annoying before the end of the show, you in the know. So, guys, how's your week? How you doing? I miss your faces.
Jeff, I feel like we haven't talked to you so much. You're working too hard.
My schedule is nuts. Yeah.
Yeah. That's what leads to burnout, Jeff.
I know. And I think we have a guest that may
appropriate topic.
Yeah. Might address my workaholic tendencies. So yes. I think we're all workaholics, but I don't know, Chad, you really seem to get the work-life balance, and Jennifer being a mom, I think it's just inherent for her. I don't know how she does it, but for me, that's always been a struggle. So I'm really looking forward to our guest tonight.
Same. I think we could always be better. I
could totally agree.
And from a mom perspective, how not to feel guilty about trying to find that balance. You know, I feel guilty when I'm working. I feel guilty if I'm doing self-care. You just feel guilty constantly. So that's part of what ultimately I think leads to some burnout is having you're constantly in a state of guilt, regardless of what you're doing, even though you probably need to be doing it. So
yeah, for me, it's kind of strange, JB. I get into these habits and I just get so or not habits, but hobbies. And I get so excited about them. And then what I find is I end up not having enough time to do them at the level that I want to do them at. So, I was an I still am an instrument rated pilot, although my instrument rating isn't current anymore. I loved flying, but when you work as much as we do, I don't want to be up there and dabble in, flying and not being the best I can be at it. So I always find that I get into these things and I'm like, I don't give it enough time. And then I find that I just back away from it completely instead of finding that right balance. So Chad, you're an avid cyclist and that's something you've been able to stay with. Is that something you found takes away from anything that you do, or does it really complement it?
That's my me time. It doesn't take years ago. Maybe it took away a little bit, but I didn't have all this extracurricular activity outside the practice with lecturing and writing and all that stuff. But now it is my unplug from life. But I can tell you that if you gave me a problem, I can solve it on a bike ride because I don't wear headphones. I just listen to the wind and I listen to me, and I can solve a lot of the world's problems. So, if you got a problem, just send it to me and I'll solve it on my next bike ride.
That used to be me when I was flying. But, again, I kind of backed away from that. For a long time, I would golf twice a week.
Yeah, that became problematic.
Yeah, it did, because that's 5 hours at a shot, and twice a week. And you can't raise kids and be gone that much and then be working all the rest of the time. And I guess it's just that I'm really anxious to hear from our guest tonight because I suck at work-life balance.
Well, Jeff, I don't know if you all know this about me, but I played golf in high school and I was actually pretty decent. But as I got further along in my career, my golf game started to dwindle. I found out that I had a loft problem with my golf game. Do you know what that is?
Yeah, I have a feeling. Go ahead.
JB, do you know what a loft problem is in a golf game?
No, I bet it's an acronym.
It is. It's a lack of blanking talent. And so I decided that it was about the time to hang up the golf clubs. And instead of consuming calories on the golf course, I would go burn them on a bicycle. So I have thought on numerous occasions of buying a set of golf clubs. And then I've said, you know what? Nah, screw that. I still have a loft problem. So
yeah. Well, that's the thing about golf is you can always go and drink even if you suck, and it's still fun, you know.
Yeah, it could be fun if you're with the right company, but
and you just play with other people who suffer from the same condition.
No, that was my problem. Is I played with people that were better than me.
Yeah,
and that really just pissed me off even more. Yeah. So I just gave it away, and now I ride with people that are better than me, and that's okay because they push me. But in golf, you can push me all you want, but this mind and these hands don't work together as well as they're supposed to. In cycling, I'll sweat it out and suffer, but golf, no.
Plus, you're a little bit of a worrier, and you can't be a worrier and be a golfer. Those two things just don't go together in any way, shape, or form.
Yeah, the last time I played golf was 3 years ago with you. I actually, you didn't play with us, but Sam Hallibo and I played the next day when we were out. I think you chose a massage over the golf outing.
Smart.
When we were out in San Diego?
Yes.
Yeah.
On the first tee box, the first one, duck hook left into the woods. The second one, duck hook left in the woods. The third one, duck hook left in the woods. Then all of a sudden,
so you had a good day.
Yeah, and this is on the first tee box. And right before we got on the tee box, this is no lie, a guy had a heart attack on that same tee box. So after the third one that duck hooked into the woods, which I thought was just woods, I hear somebody out of the woods going, "Are you going to keep doing this all day?" It was a sidewalk on the other side of a set of trees, and I kept hitting the golf ball into the people. So finally, I just threw one. I mean, we're at a really expensive golf course. They don't care what you do. You paid your dues. Just threw one, and I just decided to play foot golf the rest of the day.
Yeah. Well,
and Sam told me I probably should hang it up.
So yeah, you probably should. I might have to go along with that. But on another front, how has practice been? Because I can't go this long without talking about dentistry.
Yeah, practice. Great.
You had a good day, Chad. Tell us about your day.
Yeah, I had my good friends from Diamond Dental and Deca Lasers in the office. And so we did a little perio workshop with the hygienist and maintenance workshop with the assistants. And then we did a little lasering on oranges and tomatoes and then people. And
did I not see a picture of you in the dental chair at some point, Chad?
You did. I actually, they wanted to test the laser assisted periodontal therapy, and I do not have any pockets over 3 millimeters. But I
was going to say, were they working on your 8 millimeter pocket around?
You're reattached. It's fine. Don't worry about it.
I realized real quick that when you place the laser into a tight pocket, it makes a god awful noise that scares the crud out of the hygienist. So, and so we decided that. I didn't care. It didn't hurt, but it was a lot of fun. We had a great day.
Yeah, awesome. JB, how's your week going?
It's going really well. It's an exciting week, actually. I just want to know, you guys have probably done a fair number of overdentures and other, complex restorative. And when does the pucker factor in? I've done a ton of overdentures at this point, and I still can't help but pucker up.
The day you stop picking up attachments.
Well, it's so much easier actually to pick them up chairside than to send them to the lab.
You think so?
True. I would agree.
We have a great technique that we use, and I think we use a lot of the same materials for doing it. But still, I think when you do it right, I love for the lab to do it and not mess with that. I had an assistant actually lock a sleep appliance on a patient that she was relining, and I was saying, you've not done clinical dentistry until you've locked something in somebody at some point in your life, right?
Yeah.
But that is perhaps one of the most miserable experiences, because you can see your patient be panicked, and you're panicked at the same time, but you can't let them know that you're panicked. And it's just one of those things that you haven't lived in dentistry till you've done it. But
confession time.
Yes.
So I probably wasn't out a year when I did a hard reline on a partial, and she only had lower canines. And I'm beyond the statute of limitations. She can't see me now. So I did a hard reline. I thought I was being super slick, actually, and I did the top and the bottom at the same time. And top came out great. Let the lower one sit maybe just go too long.
Yep.
I went and I was like, oh, it's not coming. But brute force and ignorance will solve this problem. So I put my thumbs and my entire body, and I shoved the partial, and the canine was sticking in the glass. And I looked at it, I was like, huh, well,
That's a good story.
I said, don't worry, I'm not going to charge you for the extraction or to add the tooth. That's on me.
Yeah.
Don't worry about it. I got this.
You're good. You're good. Yeah, it must have needed to go. Yeah.
All right.
Talk about pucker.
Yeah. I can't top that. I'm just going to say I've had a good week because I cannot top that story.
That was a long time ago, but
I don't care.
That's space to share these.
Yeah. I mean, we've all locked stuff on, but I don't know that.
Have you ever taken a tooth out? I mean, in fairness, if you can take a canine out with a partial, it wasn't very well anchored to begin with. Let's be honest.
It's still a tough explanation.
Hey, I'm going to throw it out there. I've taken teeth out with impressions. This is not a safe space
if you're going to give me judgmental eyes.
Yeah, but we've also told them it'll probably come out in the impression in those cases. I don't think you had any idea you were taking a tooth out that day.
Yeah. You just hope it's not number 8. You just shove that little guy back in there and be like, hey, let's see what happens for the next couple of weeks. We'll have that denture to you in a couple of weeks. So,
yo, she brought me a plant the next time I'm just telling you, you need to know how to have like, it's all about relationships and marketing.
I couldn't agree more.
Okay.
That's the difference between a lawsuit and a plant. So there it is.
Exactly.
You just planted her tooth, and she brought you a new plant to replace it.
There you go.
That's a win-win-win, right?
I've never done it again.
Yeah,
but
that's how we learn.
That's right.
All right, well, let's get this show on the road. We tonight is another great show. It's been so much fun because everybody, so many people want to come on the show now, and it's just that's kind of humbling to me, and I'm sure it is to you guys. But we have so many great guests coming up, and today I'm so excited about the guests that we have. We have a special friend from the dental education world, speaker and coach, Dr. Jessica Metcalf is here. She's going to be talking about her work with oncology patients. She'll also be talking about balance, as we talked about earlier in the program, and about burnout for dentists. And so really, you guys need to stick around for this. I know I need to stick around for this. But first, I think we need to show Dr. Jennifer Bell some love.
No judgmental eyes.
Yeah. In the last couple of episodes that we've had, for some reason, we just keep shuffling you around like, oh, sorry, not enough time for news. Yeah. So with that said, Jennifer, do you have any news for us tonight?
I always have news. It's just whether we want to talk about it.
Fair.
I'm going to be all ears tonight.
Oh, I love this attention. Could someone get him some popcorn, please?
Yes.
Guys, the news is kind of, it's not super. Oh. Do you still have the price tag on those?
I do, because I would never wear these in public.
They're pretty jazzy. Okay, so let's talk about this. What in the world?
That's Dr. Gene Santucci. Who doesn't love Dr. Gene Santucci?
Asking.
ADD. Calm down. Let's listen to the news, okay? Please.
I have a lot of props tonight.
Is it time for your medication? I think maybe.
Yes.
Okay, guys. There's two things that I think are important for us to have on our radar. The first one is I had no idea until less than a few hours ago. There's a lot of momentum behind some Hipaa changes, and the ADA has come out in front and said, we're going to try to steer clear of those changes. But let me tell you what some of them are, just to get your goat a little bit. You have a 15-day response period for records, which I think is a fairly reasonable time frame. The only way that I would think that could be an issue When I've worked in practices prior to owning my own that had paper charts, if those were in storage and we had to request it from the storage facility, that did not, what in the world?
That's wrong.
I know who it is. Don't ever think that I don't know who Anchorman is. I'm like Spider-Man with this computer.
Okay, go ahead.
Stop. Let JB go.
OSHA.
Hipaa. Anywho's.
So 15 days.
15 days could be a problem if you have your stuff in storage and you have to go pull it. Anyway, especially if it's with a company. The other interesting thing is that patients can walk in with an appointment and request copies, photographs, and other things of their charts on site day of. So when they come in for their appointment, they could ask to have access to that information. I don't know about you, but that would be a pretty big burden on my team to have to then accommodate, immediate requests for record information. And the other thing would be a published fee schedule for access to records. And that would go on your website as well as wherever else. So there's some burdensome new changes that are in that particular proposed, it's not legislation, but mandates. And so there's a lot of organizations that are sort of jumping on that to kind of keep an eye on it. In the same line, OSHA is expected to come out in the next week or so with their revised or their emergency standard policy on COVID, which I can't help but find a little comical. I'm sorry, but the cynic nature in me says a little late to the game. Like most of the employees have been working in a COVID-rich environment for the last 12 to 14 months now. So
yeah. Did you know there was a polio vaccine?
Yes.
Okay.
Yes.
All right.
Yes.
Just wanted to bring your attention to that too.
Do you want
Jonas Salk, Dr. Jonas Salk.
Yeah.
Yeah.
So I know. So anyway, so when that comes into effect, it may impact mask requirements and safety parameters and other things in the practice. I frankly don't know all the things that are included quite yet in that. But there's some speculation about and there will be specific things related to healthcare facilities. I also found it really interesting. Yesterday I went online to CDC's website to see what the updated dental healthcare standards are. It hasn't been updated since December of 2020. So here we are now, facilities operating with vaccinated individuals. We've been exposed and gone through COVID now for 14 months, 15 months. And no updates in the standards from the CDC on dental healthcare facilities. And meanwhile, you're hearing from medical facilities, now Disney's not going to start taking temperatures and other things upon entry, but the dental healthcare standards haven't changed. So I know no one from CDC is watching this, but I really think that it is time for us to get an updated advice and guidelines as to how we intake patients and maybe get back to some normal amounts of business and, all that kind of stuff. Have I bored you yet?
No.
You sure?
I was infuriated, but not.
I know. There is more momentum again around the Healthy Workplaces tax credit, which would give dentists and many other facilities some tax credit and some additional cash incentives for any environmental controls they've put into place or standards that they updated within the workplace to keep patients or consumers and employees safe. There's a ton of groups, not just dental and not just healthcare, that are supporting this. It seems to be fairly bipartisan. So that could potentially be in effect for 2021. It might be another tax incentive for the moving target that is taxes these days for small businesses. So we'll keep an eye on that. And the other big thing is there's legislation for an FSA increase from $2,700 to $5,000 for health-related expenditures. And there's some momentum with that as well. So, by the way, there's no gas in my state. How's it going in your state?
Gee whiz, what a mess. I'm sorry about that. How is it over there, Jeff?
Well, I think our gas percentage-wise has probably gone up more than just about anyone in the country. we are pretty fortunate in South Carolina that our gas taxes are very low. So we started out pretty low, but percentage wise, we've probably had the highest hike in prices. It is impossible to get gas under $3 a gallon now. So happy day.
70% of cities in North Carolina are reporting no gas. So I think it's very interesting we'll see how this all plays out. But anyway,
well, they've restarted the pipeline. I think, you know, if you can get through the next 4 or 5 days, we should see. I don't know about the prices, but I think we'll see, you know, the availability return back to normal.
We've seen some staff already impacted. If they didn't have a full tanker, couldn't get to it. I mean, it's really difficult for us to leave our jobs to go do.
I was working in my satellite today, and almost, you know, I offered some of the ladies that work in Conway that actually drive to the satellite practice, I offered to go to the office and bring everybody down. So nobody took advantage, but, you know, I thought that could be a thing.
That's right.
Yeah. So,
hey guys, that's all I have today.
What?
Well, hey, in all seriousness, you did a great job. I love how you decipher all of that. It is disheartening that we're kind of like feeling like we might be close to the end of this pandemic, and then all of a sudden OSHA decides to shine their light, as well as you know, some of the, you know, let's just hit them really hard while they're already down. But hey, I don't know.
Don't you feel like that as a population, we've become very reactional to everything, as opposed to, I don't know, really just thinking things out and being proactive. I don't know. I kind of feel that way. And I think that a lot of the reactions, as you said, JB, are so late in the game that they really have no place anymore, but yet they will negatively impact us after we've already been impacted negatively.
So interesting, if you will indulge me for a moment. The last time that
you know, I'll always indulge you, JB.
I appreciate that. The last time OSHA did an emergency standard was in 1983, and I'm sure you know what that was related to, right? But
HIV.
that was likely at that time when we didn't know how it was being transmitted. The death rate on HIV and AIDS was really high, and might I add, that really actually turned into a bloodborne pathogen standard, which didn't go away.
Yep.
So my concern is obviously that this will turn from an emergency standard to a permanent standard for a disease process that we may have under control in a short period of time, that we seem to be garnering information on and understanding it better and better each day, and in a very quick fashion as compared to HIV at the time.
Right.
And so, you know, I mean, that's always my concern, is to your point that we're delayed in our response. Then we put something in an emergency standard that ultimately will likely become a permanent standard that will continue to increase the cost of doing business, which I think, frankly, dentists have been doing a bang up job during the pandemic, you know, already.
Yeah. So. Well, Kat, I don't know about you, but was that the best news you have ever heard in your life?
It was definitely golden.
Stop patronizing me. I know what y'all were doing.
I cried. I shed a tear because it was that good.
That was like a primetime Emmy worthy.
It was.
Cast. I appreciate that.
I would appreciate the nomination, frankly. You know.
I would. If I could figure out how to do that, I would nominate you.
I'd love to dress up and go walk on the red carpet.
There you go.
Dentist in the No News.
All right, guys. Well, we're running just a couple of minutes behind, but not too bad. And we have an incredible guest that I think, Chad, would you be kind enough to introduce her and bring her on?
Yes. So I would like to introduce you all to our guest, Dr. Jessica Metcalf. I have not met Dr. Metcalf in person, but I have listened in on every Saturday. She and Dr. Laura Brenner Studholm, if I hopefully did not butcher that name, they have a self-care Saturday on Clubhouse. And it is really a great thing. And I think at some point in time, I'd like to have Dr. Laura on as well, because they just do such a great job. They have an interesting following. They have really passionate people that get up on stage and talk with them. So that's one of the things I want to talk to Dr. Metcalf about. But she also, are you still practicing? Okay.
Yes, I am.
Okay, she's practicing dentist.
You said that like she's old. I mean,
no. But she's anticipating a change, I heard. So
well, that's fine. But just, you don't throw that. It's like you're expecting a baby. No. You don't say that kind of stuff to women. Well,
I have not met her in person, so I did not want to speak out of turn. Thank you. And her other cohort in crime on her Self-Care Saturday is a dentist that is not practicing anymore. So that's why I asked. So shut it, Jeffrey. I'm sorry, Dr. Metcalf.
Zip it.
But anyways, she has a website called The Alchemist Dentist, which I want to ask you about that as well. And your patient population is oncology patients. Is that what you've I hate to say specialized, not specialty, but that's
so
what
it's not. Yeah, you can't say I've specialized. We call it a special interest because there's no true, right. There's no true specialization in it. But I solely work out of a cancer center, and that is who I treat all day, every day. So the main types of patients that I usually see are the head and necks pre, during, and post radiation, surgery and chemo. And then I see the leukemias and the lymphomas before they go for their bone marrow or stem cell transplant. And then in between that, there's the breast, the prostates, the lungs that potentially have acute symptoms that present, and then they're undergoing their chemotherapy regimen at that point. So we see them, but they're not our main patient population that we see.
Awesome. Well, I definitely want to hear about that, but tell us a little bit about okay, first off, I got to ask this. All right. And I did look this up because I wanted to see exactly where you were coming from, but I found this definition for what an alchemist is. And I wanted to ask you, because the first one says a person who practices alchemy. I'm like, I don't know. And alchemy makes some pretty awesome bicycles, but this one says a person who transforms or creates something through a seemingly magical process. And I love that definition. So tell us about your journey in dentistry and how you came up with the Alchemist Dentist.
Oh, thank you so much for having me tonight, team. This is amazing. So I appreciate you having me here. So the way it started was a few years ago. I was in my third burnout. And as I was trying to come out of it, I was like, there's more that's going on. And I can't keep living like this. Otherwise, I'm not going to make it the next 25, 30 years in this profession. And I was already wishing it away. And I was like, I can't keep living like this. So first thing that I ended up doing was I was like, okay, well, I definitely need to reach out to someone because I need help. And so at that point in time, along with burnout, I was diagnosed with clinical depression and a generalized anxiety disorder. And so through that, I decided to do my own research with it because of the way that mental health, and there's always been this stigma, but no one really talks about it in dentistry. And I felt like an absolute failure. So when I started to come out of it, when I started to understand what was happening, I was like, I'm going to be the one to now create those safe spaces so people can feel vulnerable. And that's how alchemy came to be, is through this magical way of creating this safe space to break down barriers and get people the help that they need when they feel like they can't get it. And then the Alchemist Dentist came to be just about, actually, it's at the year mark now. So it's still really early on. And it's amazing how still, even though I'm putting my story out there, people don't feel comfortable sharing that yet. And I really appreciated when you guys said that early on. It's, you guys are trying to create that safe space, a no judgment zone, right?
Right. That's what we were trying to create.
Except we judge each other sometimes, maybe not everyone else out there, just amongst ourselves.
Yeah. Well, so and this is the thing, like, kudos to you for sharing the fact that something happens. Like, the fact that it got locked on the fact that something went wrong, because 100% we've all experienced some sort of trouble, and you're in the middle of it, you're dripping sweat where you didn't think you could drip sweat from, right? Your heart rate's about to jump through your chest, your increased breathing, and you've got to maintain this composure. And so stress on that very individual event is fine. That's a normal bodily response. But when you're consistently being exposed to it on a regular basis, you're now being heightened. And so it's trying to understand, okay, there is a huge difference between stress and burnout. Stress is a temporary adaptation, right? You're automatically trying to problem solve. What do I do next? How do I take this out, right? Versus burnout is a very blunted state. You have this feeling of hopelessness. So it's not just that physiological response, there's also an emotional now component of it too.
So I love how open you are. I think that I'm not going to ask ages by any means, but I think that 20 years ago, I can tell you that anxiety and depression were kind of like, get over it. You're fine.
Yeah.
You know, that doesn't exist. People didn't even know how to describe it. And I think that we have learned so much about it, and it is definitely in my family. Of course, not me, you know, but no, my family's affected by it. Our friends are affected by it. We see it so much more. And I love how people can actually talk about it and share their journey with other people. And you don't, I mean, you know, because of what you do, but I don't think you truly know the depth of your sharing that and how many people you have the opportunity to help. And I think that that's really cool. And so kudos to you for actually getting out there and talking about it. And maybe the Self-Care Saturday makes a little bit more sense to me now. I'm teasing, it's always made sense, but it just really it is really amazing that you all are able to do that, and what you're doing and the topics that you're discussing on Self-Care Saturday. I mean, you know, when I listen in, it's just, it hits people in different ways, and it's really, really awesome. So kudos to you for sharing that. Tell us a little bit about, like, was this just like, I'm looking for a job, this clinic's hiring, I'm going to treat oncology patients? Was it a passion that you had beforehand, or was it a passion that became after being in there, or is it a passion?
It's a huge passion of mine. I worked in private practice for a little bit. So after dental school, I went to school in Boston University and then returned home to Toronto, Ontario, where I completed a GPR with patients. My specific way which I was going was treating special needs patients and medically compromised patients. And during that time, oral surgery was very prominent in the program, and I fell in love with oral surgery. Applied 2 years in a row, didn't get in. And about 2 weeks later, the chief of dentistry reached out to me because he knew that I had been applying, and he sat me down and he's like, listen, I know you're really upset right now. And he goes, but I think you're going to be able to get everything that you need at the cancer center. And I went home and I thought about it, and I was like, you know what? I think it is. So I ended up starting there, and then it evolved into this absolute amazingness where I've now been there for 5 years, and then became education director, special projects manager. Then over the summer, I was acting deputy chief of dentistry. And it's, for me, I don't think we recognize how much general dentistry plays a role in the oncology patient's journey. And I call it a journey because that's exactly what it is. Because each one of us has had either someone they know personally or know of someone through someone who's had cancer. And everyone's journey is completely different. And the way that I like to lecture on how the general dentists play a role in it is the fact that palliative care is not just what we think, where we think end of life. Palliative care is managing long-term side effects. Xerostomia, change in taste, patients just not feeling comfortable anymore after they've received head and neck radiation or after they've received their transplant. And so for me, being a part of their journey and helping them cope with these, I know we're using this buzzword all the time, but I like to say I was using it before, the new normal. It's their new normal, right? And so I feel like the biggest thing for me was I got to now sit down with them and go over all of this management care, eventually getting them back to their family dentist, right? So it's giving them enough tools, and then me communicating with the family dentist on, okay, this is the importance of what general dentistry is for the oncology patient. Because I think at times there's this misunderstanding where it can be too complex and then people get scared to treat them.
Yeah.
That is
I
so
have a
awesome.
question, Jessica, because so I have a couple of questions if I can jump in, because seriously, I know I'm the guy that's always joking around, but I really, you've hit on so many things that mean so much. And as most of the people on are general dentists, not all of us, but most of us really develop relationships with our patients along the way. And it's incredible how many of our patients end up going through that cancer, journey, whether it be chemo, radiation. And, I think it's something we think, oh, they're not getting head and neck radiation. We don't need to worry about anything from our end. And yet I've met so many people just this year. One of my son's best friends was diagnosed with Hodgkin's lymphoma, and he has started down the road of chemotherapy. And so I started talking to him about mucositis and some of the early treatments to help prevent that. Because, I've watched people with bad GI cancers, and mucositis can actually end up be what ends up killing them, because they can't eat. They can't get any nourishment. They're so miserable that, they end up going downhill from something that potentially could have been controlled. So where do we look as general dentists for a curriculum in treating oncological patients? I think this is something that is so needed and that we just don't get enough information on.
Mm-hmm. I completely agree with you. I feel like there is a huge lack thereof at this point in time. I'm going to totally plug myself, because so in 2 weeks, I'm leaving the hospital and moving across Canada. And in my entire 5 years that I've been there and teaching the residents and the fellow, I've didn't realize how much information that we just don't get taught. But because this is what I see all day, every day, I was like, how am I going to get this information across? And so there's primary research out there, but it's really hard to kind of try to comb through. And so I'm actually in the middle of putting together a booklet. So then you have the questions readily available, whether they're pre, during, post, pre-chemo, pre-radiation, pre-surgery. Because I feel like there's a couple medically compromised textbooks out there, but the cancer section is still so very small at this point that you're not able to ask the right questions because you don't know what to ask, right?
So I'm going to get on a soapbox because, and it's not a question, I just want to have an open dialogue.
Yeah.
But I was just having this conversation with a good friend of mine who's a PA oncologist here in my town, with a big university medical system that's treating a tremendous number of cancer patients in our community. And they don't have a dentist anywhere on the team. And how many patients show up in my office after or during treatment where we should have done things beforehand, especially because they went on IV bisphosphonates, or, to Jeff's point, mucositis, xerostomia, head and neck cancer radiation, and the dentist is not on the team, whether it's their community dentist who might be capable of being that partner, or just a dentist that works for the hospital. And so, my brain is sitting here thinking, what a phenomenal program and what a great benefit you are providing for those patients, that you're walking that journey with them. And then, having that ongoing relationship with their community dentist. So everybody's participating in their care, because it's ultimately about the patient. And what a missed opportunity for, I don't know if this is just a United States problem or just local to my community, but what a missed opportunity for the patients in our area who don't have a full team of specialists who are looking at all the different comorbidities, complications, side effects, et cetera, of cancer treatment. It's reassuring to know that you're going to put some additional information because that gives dentists like myself the ability to go present myself in front of panels of folks and say, this is how we need to be involved in the team. It's not about financial reward or anything else. It's about co-sharing of care. And I absolutely love what you're doing. And I just praise you and hope that you can find an avenue and a launch pad to take that so it's more globally acceptable. And sounds like Jeff's suffering from similar challenges. So
Jeff's suffering from the fact that he's got like a million questions and he's looking at them. He is like stuck in a cage. Like, I gotta ask this question. Dang it!
Well, thanks for letting me have a moment, Jeff.
This is different. I mean, I've gone through this with, you all know I went through this with one of my friends who just went through GI cancer, and we were doing the oral mucositis was probably one of the worst side effects of her treatment that she endured.
Yep.
And I never, until I had someone that close to me going through it, I did not realize the burden. And I mean, we went through everything down to using cannabis ointments that helped, and laser therapies. And, we were just looking into everything. And I think we're just not doing nearly enough. And even my son's friend who was diagnosed with Hodgkin's lymphoma, I said, he's at Duke. I said, did they talk to you at all about any of the side effects of chemotherapy? No. And I reached out to his dad and I said, listen, I'm here. He's gonna have some things that go on in his gut and in his mouth, and I'm here to help. But then they're like, well, why would the people at Duke not say anything to us? I mean,
well, So this is, I feel like this is just a generalized conversation in regards to where dentistry fits into medicine.
Right.
Right. And I feel like this, we keep having these conversations. So in medical school, I think most medical schools do like teach dentistry in like 2 to 5 days or something. We get 4 years out of it. Right. Like there's a reason for that. And I don't think that we, as a community, are doing justice in trying to express how we need to be connected in the medical community as well.
Yeah, no question.
So I'm going to open an invitation to you, and I will tell you that I would love for you to post any insight, tips, whatever, promote what you are doing in any capacity on our group, because you are fantastic. You are truly one in a million. Would you tell us what time is your self-care Saturdays? I know that I'm in Central Time Zone. I believe it's like 10 a.m., 9:30 a.m. Central.
So I'm gonna go Eastern Standard Time. So it's 11 a.m.
We call that normal time.
Yeah. So that would be 10 a.m. Central, 11
We just call
Eastern.
that the time.
The time. Right.
Yeah.
So 11 a.m. Eastern, Central, 10, and then I think Mountain, where Laura is at, it's 9. So it is fantastic. I encourage both of you to listen. So
I absolutely will. But I have 2 really pressing questions for you. This is what everyone wants to know. One.
Yes.
Do you know who that guy is behind me right there? Because you're Canadian.
I can't see
Can you see back there? Over my left shoulder? He is the bassist for a Canadian super rock group.
Oh, dear Lord.
I don't know.
You don't know?
I'm not good with names.
Your Canadian passport has been revoked. That is getting me from Rush.
I wish.
Oh my God. I'm trying to go through and I'm like, who's Canadian? Who's Canadian?
Okay,
I wish I could text you,
other,
because I would have texted you the answer just so you could, have showed him.
The only other question I have is it composite or composite?
It's composite.
So
Yeah.
Did you carve a soap for your DATs?
Yeah, I took both. I took both Canadian and American. Yeah, and main difference was organic chemistry and math for American, and then soap carving.
I studied with some Canadians for their DAT, and I was always so fascinated by the soap carving. I actually kind of wanted the Americans to take it up because I thought, this is a real skill, people. We need to know how to carve soap.
So,
it didn't get traction. Again, another thing I get on a soapbox about that doesn't get any traction.
I know you said that you're moving across Canada, and I don't know that you mentioned what you will be doing. Is it a similar program out there?
So I'm actually taking the summer off. So I'm working on the Alchemist Dentist, and I have a couple courses that will be coming out by the end of the summer. So that's where majority of my focus will be. And then come September, I'll be only going back part-time to doing clinical dentistry, specifically geared towards treating oncology patients.
Well, good for you. I think that's fantastic. And the first one I was on with you was talking about finding your passion. And it's really cool that you have, and you definitely can tell that you love it. I couldn't do cancer patients wholly because I tie too much of myself to them, and it drains me. If I lose one, I'm done. And so it takes a very, very special person. So thank you. I would love for you to interact with us as much as you want to, and I'd love to have you back maybe when you get settled. And we're gonna get Laura on here. Maybe she can tell some bad things about you, but I don't know. I don't know.
I'm not sure that there's any.
Thank you.
But please keep us posted on your journey, and feel free if you would like to post regularly. We'd love for you to, because you've got some great insight, and all it's going to do is promote the great work that you're doing. So thank you so much.
And we will absolutely touch base, because all three of us are doing a lot of CE in the US, and your voice needs to be heard a lot more. And so I know I speak for both Chad and JB when I say we would love for your voice to be heard more in the dental community.
I appreciate that. Thank you so much.
Yeah.
Thank you. Thank you. Thank you so much for coming, and we'll have you back. So be prepared to get emails from me. And I got to throw this out there. Okay. So like, I didn't really
can you
know
say composite?
Composite. But yes, I didn't really know. And I think she kind of might've thought I was a Facebook creeper when I was sending her messages or whatever. And then she's kind of like, okay, so what is this again? And so I explained it, but thank you for accepting the invitation. And I'm just going to say, I told you two that she was going to be awesome, and she was. So
you know what? She gets a Penraka.
Yeah, there you go. There you go.
I appreciate it.
No one's ever gotten that award before. You're the first recipient.
You are the
Penraka.
first to receive the Penraka.
Yeah.
It would be appropriate for no one else to mention that in case the next person does not get the Penraka.
Right.
I don't want anyone's feelings to be hurt about the Penraka.
Yes. Well, thank you so much, and we'll be in touch. Okay, Jessica.
Thank
you.
Jessica.
Bye-bye.
Have a good night.
Night.
Well, I don't
Ange is partly Canadian.
Is she really?
Well, I give her a hard time. She was born in North Dakota, which, as far as I'm concerned, is basically Canada.
No, it is not. It is not. No, they
close.
do not apologize nearly as much in the Dakotas as they do in Canada.
Or ask as many rhetorical questions. No, I'm kidding.
I'm Canadian.
Are you really?
Well,
I thought you were born in Louisiana.
He says he's everything.
Okay.
Listen to the story.
Let's hear your journey.
So my family was Duplanchet, T-I-E-R. They came from Canada to Tennessee to Louisiana. So I think I can label myself as somewhat Canadian. At least some of my ancestors have been there,
And now it is completely obvious why you did not know what alchemy meant.
Alchemy makes a pretty awesome bicycle. So when I think of Alchemy, I think of a magical bicycle that I almost bought,
And
but no one
there
said
was
that's expensive.
There was a great jazz group. So this is something no one knows about me, is that I used to be a real jazz geek. And that's when I would study in dental and dental school and in college. I always found that I could never study listening to music with words, but I got really into jazz. And so there was a group called Acoustic Alchemy. And that's probably the only reason I know what alchemy means.
Well, there you go.
Mm-hmm.
What do you guys have going on? Big news, announcements? What's happening? By the way, really quick, when you guys were talking about oral mucositis and managing pain, that is a huge use for photobiomodulation, PBM, and your DECA lasers and all that good stuff. We
were actually talking about that today.
Yeah.
But they did mention that PBM is going to be more beneficial for that.
It is. And the thing is, it's actually a big response to the opioid crisis as well, because part of the oral mucositis side effect is that a lot of them end up getting addicted to opioids because they were being managed for the pain and discomfort associated with side effects of chemotherapy and other things with opioid treatments. And PBM, they're trying to make that a much bigger part of the side effect management, so that obviously there's less addictive side effects and stuff.
Let's hope that we can get and hopefully in maybe in the ADA and the AGD we can get some focus groups to look at really starting to get reimbursement for these patients for these procedures, because that's that actually breaks my heart. And I can't tell you how many of those procedures I have given away just because I'm not going to sell somebody a 10. I get it. The oncologists have no problem saying, here's our fee, you have cancer, whatever.
Right.
But I end up just finding myself feeling so bad and feeling
you do
like I'm trying to pile on. I'm like, let me just do whatever I can for you as a value-added service here. But I really think that we need to push harder for medical or even dental reimbursement for oncological services, especially oral mucositis.
I'm really going to reach out to her soon, because I think just even a good starting talking platform would be management of head and neck cancer radiation. Just like a top 5 things. I have a few things that I do just that I learned on a residency rotation that made a ton of sense to me, but I'd be really curious to see, what are some of the common things that she's doing, because I think that's, then that's not a billable procedure. That's just having a really great supportive conversation with patients. And that's being a team player. So I love that.
Yeah, for sure.
Well, I don't think it could have gone.
Do y'all have any lectures or anything the rest of the week? Nothing?
I have. So last week, well, Chad always posts his. I'm lousy at posting my lectures, so I will talk about it. So last week was a pretty cool week. I spoke for the AADSM. I did a lecture for them. I got to do my first live lecture in a year for the Carolina Sleep Society, which was great because I really love that group, because it's physicians, it's sleep techs, and it's really a very collaborative group. And to have that,
I love that.
The first live lecture that I did, and have physicians and sleep techs and respiratory therapists in the same room, that was just awesome. But I also started last week with Midway Education. We started the first part of our sleep series. Dr. Gene Santucci and I have collaborated on a sleep series with Midway Education, and we started last week. If you missed it, I know that they were keeping it up for 7 or 8 days, but I'm sure if you missed the first one and you contact Midway Education, they'll let you in on the first module. But our next one is going to be next week, May the 21st, Friday. And then our third one will be on June the 4th, which is also a Friday with Midway Education. So I'm excited about that.
I tuned in. It was really good.
Oh,
it
thank
was
you.
really good.
Yeah, it's fun. Gene's a great guy.
He is.
And he's a great educator.
And he's a magician too, which is pretty
Is he really?
Yeah.
Yes.
Yeah, Gene's a really, really neat guy.
Oh.
I had to move my father-in-law's house last week, and I really wanted to watch that because I don't know about the other presenter, but Gene Santucci is one of my favorite people.
The other presenter was crap.
So sometimes I do presentations like this. Like I will speak into the microphone, but I will hold this picture up because that's how much I love Gene Santucci.
But nobody has Gene's voice, and Gene's got a very calming, soothing voice.
He does.
He is the Mel Torme of dentistry. I love his voice.
Yeah. Gene's
Chad, anything coming up?
It's kind of quiet. I kind of have taken May off my radar a little bit, and the majority of August because graduation in 2 weeks, and then off to college. So trying to stay in good graces with the family, but it's just working on. I'm still busy, but
of course you are. Is he
balance, Chad. I love it.
for the summer and then going?
Yeah, he'll be home for the summer, and then he's going, and it's getting close go time. So
it is.
Yeah.
So,
and you honestly, you have someone in your home that you need to hold very tightly over the next couple of months. So
maybe me.
it might be you and the dogs. The dogs are going to be sad.
It may be me. I don't know. I think I agree. Yeah, it's a lot of fun. So, but we're excited. So,
well, great show, guys. I mean, that was awesome.
Really great.
I cannot wait to engage with her more. That was she was an amazing guest, and we'll definitely be doing more with her.
Yeah,
we will.
There's so much value there for our membership to hear from.
Exactly. Yeah. Exactly. So, guys, anything you want to hear about? Anything? Any topics that come to mind? Please reach out to us. Chad is absolutely amazing every Monday at reaching out to all of our new guests. Well, okay, you're not that amazing, but Chad reaches out every Monday to our new members, and we try to encourage everybody to participate, but we really mean that. We want to give you what you want to hear and the information that you need. So do not hesitate to reach out to us, message us through our Facebook. We have our webpage. We have our Instagram page. We are going to be doing more and more with our podcasts, and it's just great things coming. So guys, always a
next
pleasure.
Week,
I
will be hopping on live from Birmingham, Alabama.
For the implant thing.
Not in an Uber, hopefully this time. Can't promise. But anyway, we'll be in Alabama. So I'll at least be live on location, like the real journalist that I am.
Awesome.
At the end of this month, you might see Chad and Jeff live from a remote location.
Appreciate the invite, guys. Really appreciate it.
Well, we did invite you, but you didn't go.
No, you did not.
Okay. All right.
Okay.
All right.
Let's take this offline.
Bye, guys.
Good night.
All right. Have a good night. Love everybody. See ya.